If you take amlodipine, lisinopril, or any daily blood pressure medication right after you wake up, I want you to go grab your pill bottle right now. Just hold it in your hand for a second. I need to be completely straight with you. By swallowing that pill alongside your morning coffee and breakfast, you might be walking right into a chemical trap. In my clinic, patients always tell me they feel dizzy when they stand up from the breakfast table. They think it's just old age. It isn't. Most people don't know that your absolute highest risk of a dangerous fall happens between 6 a.m. and 8 a.m. It's not because you're clumsy or because your balance is suddenly failing. It is because of a very specific reaction that happens when your morning routine collides with that medication. I'm going to tell you exactly what time of day you actually need to be taking your blood pressure medication to stop this from happening. And before we finish, I'll show you a simple 1-minute movement you need to do in bed before your feet even touch the floor. It takes zero effort, but it completely stops the dizzy spells caused by these pills. If you want to walk to the bathroom or the kitchen without feeling like the room is spinning, keep watching. Do not change your medication schedule today until you hear this entire explanation, because we need to look at what happens inside your veins the second you swallow that pill. To stop the morning dizziness, you have to understand what amlodipine is actually doing inside you. It belongs to a group of drugs called calcium channel blockers. If you take it, you already know it lowers your blood pressure. But the way it does this is the exact reason you feel lightheaded. When calcium enters the muscle cells of your heart and blood vessels, it makes them tighten and contract. Amlodipine blocks that calcium. This forces your blood vessels to relax and open up. Think about a tense, tight muscle suddenly completely relaxing. The pressure drops instantly. From a cardiovascular standpoint, this is exactly what we want to prevent strokes and heart attacks. But here is the catch. This forceful relaxation of your blood vessels doesn't just happen when you want it to. It forces your vessels to remain wide open no matter what you are doing. And this introduces a massive mechanical problem for your body. When your blood vessels are forced wide open, it takes a lot of effort to push blood up against gravity, from your feet all the way up to your brain. It's like trying to drink water through a massive, wide pipe instead of a small straw. The suction just isn't there. This is the root cause of your dizziness. But the real danger only happens when we mix this open vessel state with what your body is trying to do the moment you open your eyes. Your body doesn't just wake up randomly. It operates on a very strict 24-hour internal clock. While you are asleep at 3 a.m., your blood pressure naturally dips to its lowest point. You are resting, so your brain doesn't need a heavy flow of blood. But about an hour before you naturally wake up, your brain sends out a massive chemical signal. It releases cortisol and adrenaline to shock your system awake. This naturally spikes your blood pressure. Your heart beats faster, and your blood vessels naturally tighten up. This morning surge is a survival mechanism. Your body is trying to build up enough pressure so that the moment you sit up in bed, blood shoots straight up into your brain and you don't pass out. It is a perfect balancing act. For seniors with hypertension, this natural morning surge is often way too high, which is exactly why I prescribe medications. But what do you think happens when we drop a powerful, vessel-relaxing pill right into the middle of this delicate morning wake-up routine? You get a biological collision. Your body is trying to tighten the vessels to get you out of bed, and the pill is aggressively forcing them open. Let's look at exactly what happens at 7 a.m. You wake up. Your body has just released those hormones to tighten your blood vessels and build pressure. You walk into the kitchen, pour a cup of coffee, and swallow your amlodipine. Within 30 minutes, that medication hits your bloodstream. Your body is saying, "Tighten up, we need to stand and walk." But the amlodipine is commanding your blood vessels to relax and stay open. Your morning coffee adds to the chaos by forcing your heart to beat faster against vessels that refuse to tighten. Because amlodipine is a highly engineered pharmaceutical, it wins the fight. Your blood vessels are forced wide open exactly when your body needed them to be tight. In medicine, we call this orthostatic hypotension. It means a massive, sudden drop in blood pressure when you change positions. The pressure inside your body drops too low. When you push your chair back and try to stand up from the table, the collision peaks. Your heart tries to pump, but the vessels are just too relaxed to maintain the pressure. The blood has absolutely nowhere to go but straight down. Because the medication has forced your vessels open, gravity takes over. The moment you stand up, all that heavy blood rushes downwards. It pools heavily in your calves and ankles. Because the vessels are too relaxed to squeeze the blood back up, it just sits there in your lower legs. Within seconds of standing, your brain realizes it isn't getting enough oxygen-rich blood. This is exactly when the room starts to spin. Your vision might go slightly dark or blurry. Your legs suddenly feel incredibly heavy, like lead, and you have to grab the kitchen counter just to stay upright. This is the blood pool effect. For many of my patients, this dizzy spell lasts for 10 to 20 terrifying seconds before their heart beats fast enough to catch up. But in that brief window, a single misstep can lead to a fall. And for a senior, a morning fall often means a fractured hip or a head injury. The tragedy is that my patients blame themselves. They think their balance is failing. In reality, it is just gravity exploiting the fact that they took their blood pressure pill at the worst possible time of day. So how do we actually fix this? The answer is a practice called chronotherapy. This is just a medical term for timing your medications to match your body's natural rhythms. For years, doctors told patients to take their blood pressure pills in the morning because it was an easy habit to build with breakfast. But we now know that this is flawed for a lot of people. Many cardiologists are now recommending that you take amlodipine at night, right before you go to sleep. By shifting your pill to the evening, the medication does its strongest vessel-relaxing work while you are lying flat in bed. Because you are horizontal, gravity can't pull the blood down into your legs. There is no dizziness. Even better, as the medication stays in your system overnight, it actively suppresses that dangerous early morning blood pressure spike. By the time you wake up at 7 a.m., the drug is perfectly balanced in your system. You wake up with stable blood pressure, without the sudden, aggressive widening of the vessels that causes morning dizziness. Talk to your doctor before you change your routine, but asking them about moving your pill to the evening could save you from a major fall. But what if your doctor wants you to keep taking it in the morning? Or what if you just want an extra layer of protection against feeling dizzy? You need a physical way to fight gravity and push that pooled blood out of your legs. To do this, we use a piece of anatomy that we often call your second heart. I'm talking about your calf muscles. Your calves do a lot more than just help you walk. Hidden deep inside the muscle fibers of your lower legs is a complex network of veins with tiny one-way valves. When you flex your calf muscles, the muscle expands and contracts, physically crushing these veins. This crushing action works exactly like a pump. It